A new tool in the fight against prostate cancer is now available in the Treasure Valley and has already proven to be incredibly effective in finding and identifying cancerous cells that are attempting to spread through the body. I talked with local doctors and a grateful patient about the new technology. Prostate cancer is unfortunately more common than we may think.
Aside from skin cancer, it is the most common cancer in men in the United States, with about 300,000 men diagnosed per year.
He adds that about 1 in 9 men will be diagnosed with prostate cancer in their lifetime, so the importance of regular testing can't be stressed enough.
But at the end of the day, the most important thing is prevention and early recognition, and the way to do that is with prostate cancer screening.
But after a prostate cancer diagnosis and treatment, it historically hasn't been easy to find cancerous cells that have spread through the body. That's where the PSMA Pet Scan can help.
It uses an agent that targets PSMA, which is a protein that's expressed at very high levels on prostate cancer cells. And again, that's regardless of where those prostate cancer cells are located, whether they're in the prostate or in the bone or in other parts of the body.
So how exactly does it work?
When our patients arrive at our facility, we put an intravenous line into one of their veins and we're able to inject this material into the veins. It then equilibrates within the system, and after about an hour we are able to image the patient in the scanner that you see behind me.
It's a game changer for detecting prostate cancer in hyper-specific areas and something the medical community is thrilled to have.
This particular imaging modality has been incredibly exciting because it is so much more sensitive and generally more specific than all our other imaging tests. In one test, one is able to get more information than with a lot of other tests put together.
Because this test is so accurate, it again allows us to choose the ideal treatment for each specific patient, whether that treatment is surgery, radiation, or other medications.
Currently, the PSMA PET scan is available at 2 locations in the Treasure Valley, as the technology has only been around for roughly 2 years. But I had the good fortune of talking to a gentleman who was one of the first in the area to utilize it.
It found 2 very small spots, which he showed me after it was over. And at that point, he said he recommended we go ahead and have radiation to take care of that area.
Using the PSMA scan, doctors knew exactly where to target, leading to a happy outcome.
The PSA dropped from 1.5 down to 0.1, and I believe, or I'm told, that it's possible it'll go away in another year or so.
And a happy patient.
I would recommend it for anyone. It's very simple, very easy, there's nothing to it, and it obviously is very effective.
And on that note, if you'd like to help support a great cause at a fun event, the Idaho Urologic Institute will be hosting a Blue Ribbon Rally Car Show this Saturday from 10 a.m. to 3 p.m. Proceeds will then go to local organization Idaho 2 Fly, which is a wonderful group that supports men with cancer and benefits prostate cancer research. For more information on the car show or the new advances in detecting the spread of prostate cancer here in the Treasure Valley, you'll be able to find this story on our website, idahonews6.com.